All right, welcome back, everybody. You are watching the Now Morning Show right here on TTT. Now we're going to have a conversation with Dr. Erica Wheeler. During the Prime Minister's press conference on Saturday, it was announced that we are now experiencing community spread. Here to discuss the implications of this is none other than Dr. Erica Wheeler, who is the WHO and PAHO representative for Trinidad and Tobago and the Dutch Kingdom Islands. Good morning, Dr. Wheeler, and welcome.
Good morning, Carrie. Thank you.
Now, the term community spread has now been officially used to describe the situation here in Trinidad and Tobago. Tell us what that means.
Well, now that we have community spread, it actually means that unlike when you have sporadic cases where you can identify the source, or when you have clusters where, again, you can identify, for example, if it's a family, you know that it's members of the family, it can be traced back to. But now when we have community spread, it actually means that we are not always sure from whom the infection was acquired. So that is the difference between sporadic clusters, which are both are identifiable, and now we're in a situation we actually don't know the source of some of the people who were infected. They don't know who they met or who possibly they could have got it from.
Right. So that is very worrying. So tell us about the increased risk now.
Well, we are in a situation now where we have to really make sure that we step up our game, and let me explain the different parameters of what needs to be done. Testing is critical because obviously unless you test people, you know who they are, you won't be able to identify the source of the infection and isolate those persons. So testing in a timely fashion so that results come back in a period of time that's not long, because what the danger of having a lapse of time between when persons are tested and when they get their positive results is that persons do not necessarily quarantine. Even though they're told they have to quarantine at home, they don't. So it means they can be going about and spreading the infection. So we need not only to tell people to quarantine, they need to be monitored. They must be monitored. Otherwise, they will leave their homes, some of them. The other thing is that when people do go to get tested, they need to be tested in a timely fashion, which means that when they recognize they have the symptoms, if they call the hotline and they don't get through, or if they go to a clinic and they don't get through, that lapse of time can also lead to them spreading the infection to others. So testing in a timely fashion, getting their results back, making sure people quarantine and they are monitored during their quarantine, all of those things are critical. We know that sometimes between the time you get a test and it goes to be tested, whether it's negative or positive, there is that lapse, okay? The other thing is with the increase in volume of the number of persons now to be tested, we need to ensure that there's sufficient testing sites. I know that at least a couple of months ago, PAHO trained some 50 people in the government. If it is necessary, we will train more. So having sufficient testing sites and enough persons to do the testing. The other critical thing is contact tracing. We cannot say this enough, that there must be enough contact tracing. Primary and secondary are critical. And if any of those prove to be positive, then their contacts, for example, secondary contacts will also need to be traced. Because if we don't do that, then again, we just see cases popping up, but we can actually try to help control some of the numbers of infected people if we do systematic contact tracing. The other thing I don't want to forget about is the health workers themselves, that of course they have enough personal protective equipment. We know that this is critical and that they remain vigilant, but also that we take care of their mental health now, because now we will have we are already having a significant increase in cases. We know that doctors, nurses will be under enormous pressure. So we need to ensure that they have a space to deal with their own issues because they have families and they leave home and they have to come back to their home. So taking care of the health professionals themselves is important. And then the whole package of making sure that we have that almost seamless move in your health system. So you need all the things that I've said about making sure people get tested, making sure that the samples are received in a short as possible period of time. We know that the government has something called gene expert machines, which means you can have results back in a day rather than maybe 2 days. But really, waiting a long time is detrimental to, the spread of the virus. Right now, it's everywhere, so we can't say if you can close churches, but you can't close down some other places, where people gather. So reducing the number of people circulating is critical. But we have to balance this with the fact that businesses have remained open. So we can't cripple the economy because until such a time that we have both efficacious treatment and vaccines, we will have a situation where we will have to reduce the number of people in circulation while we try to do all the other things that I've just mentioned about making sure people get tested and quarantined. And that we continue to support the system where you have isolation facilities as well as step down facilities. So all of these things, strengthening the health system as a whole at a time like this is critical. And that is why we need good surveillance systems and good lab systems.
All right, Dr. Wheeler, let me just jump in here. Good morning. There have been some complaints about the temperature guns and the radioactive exposure, as well as the malfunctioning of some of them. I wanted to comment on this, as well as I wanted to find out what the ideal temperature was, the range that we're supposed to be looking out for in one. What happens if you go above or below it?
So yes, we know that those temperature guns are not 100% effective. That is just the reality. Okay, we know that they're one part of the package, but we know they're not 100%. But in terms of being radioactive, that is not true. There is absolutely no evidence, and I know some people have been concerned and have had this question, but there's no evidence to show that there's any radioactivity given off by the guns. But what I would say is you have to make sure when persons are coming to work or coming into any environment, if they're your employees, they should know, and unfortunately we know people are not always compliant. They should know if they're ill that they should not come to work. So any temperature above 38 degrees, we should not be encouraging persons to come to work. So I would say actively that persons should be encouraged to take their own temperatures at home if they're not feeling well, or excuse me, if they really feel they need to have medical attention, then they should do so. But parents should be attentive to their children. They should check them to make sure if they complain of not feeling well that they take their temperatures, okay? So the thing is, we have to recognize what we've said in the beginning. This is an all of society approach. It is not just about the government doing things. Individuals have to take responsibility. So if they don't, it will continue. It is inevitable because we are driving it by our behavior. You can put everything in place, but we also need to be socially responsible.
Definitely. But Dr. Wheeler, is there a minimum temperature that we should be looking out for on the
A minimum temperature.
Yeah.
Well, if your temperature, I would say maybe 34, 33, that is quite low
Right.
compared to the normal body temperature. But that is opposite. That it's when you have a fever that they're more dangerous, not when they're cold. Because even when you feel cold, it's because you have a fever. If there's nothing else wrong with it, if you don't have any infection in your body, you should not be feeling cold but yet have a fever. So that's a sign that something is wrong. Okay. So certainly, persons should not be allowed into a building if their temperature is above 38 degrees, for example. And if the guns are malfunctioning, then you have to maybe take other measures, such as make sure you have the names and the addresses of persons, or depending on the situation of the business, they shouldn't be allowed in if they feel there's any risk. So it's very tricky about the gun. If the gun isn't working, what you do, you can't always tell when people are physically ill, because sometimes you may get up and feel you have a temperature and take a Panadol and your temperature goes down, but you are still ill. So that's a very tricky one. But I would say that that line between honesty and dishonesty about saying if you are ill is a critical one, and that it's up to individuals to take that responsibility. Businesses can only go so far in the use of their thermal guns, but certainly maybe they should have spare ones just as a backup to make sure it's something they have. But it's only one of several things that they should be doing in the workplace, because if you come to work and you work in your cubicle and you're not coming into close physical contact with other persons again, and you're washing your hands, you're still reducing your risk. So remember, this is part of a package of public health measures. You can't rely on that on its own. That's dangerous.
Dr. Wheeler, just to jump in here a little bit, you were speaking of fever being one of the symptoms, but when it comes to those who are asymptomatic now, I've heard in international reports that one of the lesser known symptoms of people who may be asymptomatic is that they may lose their sense of taste and their sense of smell. How true is that from the WHO's standpoint?
Yes, that we are discovering more and more things about this virus. And taste and smell, certainly for CDC. CDC has put that on the list, and I believe more recently WHO has as well. Now, the danger of asymptomatic people is just that. They don't even know themselves that they have, that they may be carriers. So it is very difficult to make rules for asymptomatic people specifically. But when you think about it practically, let's be really practical about this. This virus is spread, it's not an airborne virus in the sense that if you go walking or if you're in the same room as someone and you have your WHO prescribes a minimum distance of 1 meter, this government says 2 meters. But think about it. If you don't come close to other persons and you are wearing your mask when you're supposed to, and of course, you're keeping your surfaces clean. If you're in an office, it is your desk. If you're in a home, it's your surfaces. How can you easily transmit it? So, but this is why when you're in public, the need to wear a mask is so critical, because if you yourself, remember, wearing a mask, it means that you are protecting others from the virus coming from you, your droplets. So if you are wearing a mask, it means the droplets have less chance of escaping if you are asymptomatic. So this is where wearing a mask is so critical now that we have community spread. And this is why also keeping your distance from others, that combination of wearing your mask and social distancing is so critical at a time like this, that if you're asymptomatic or even pre-symptomatic, you wouldn't know. But if you observe the public health measures, then there's much less chance of giving it to someone. And now that we are going to have only 5 people at a time congregating, then again, you reduce your risk further. So I think the problem is the things that we are saying sound so simple that people think, well, that's not really important. It only means doing that. But that could be the difference between life and death. Literally. For some people. For example, if you have elderly relatives, don't visit them, So there are things that we can do to protect ourselves and to protect other people as well. And we just need to observe them. If you have a relative at a nursing home or something, don't go to see them. Don't visit your elderly relatives. Don't gather in big groups, and keep your distance and wear your mask. It's all we have right now until we have an effective vaccine. So we need to not think that it's too simple and therefore we should discard them, but we need to practice doing them because this is our new way of life.
I couldn't have said it better myself. And with that, I want to thank you so much for your time this morning, Dr. Erica Wheeler, who is the WHO and PAHO representative for Trinidad and Tobago and the Dutch Kingdom.